rolling out of the vaccines to the next group in Australia, which is a very broad group, is so exciting for us because it means the most vulnerable in our community are going to be protected, and it means that we are actually going to be able to see people reunite with family members with very little difficulty. We'll see greater movement between states and territories, and ultimately it will mean for the whole of the country the opportunity to start moving beyond our borders again, and for personal travel, for business travel, and most importantly for those people who've been caught overseas and can't get home, both here in Australia and overseas coming back to Australia, being able to return home. I think it's just the most wonderful thing. So our first day at the clinic, we've vaccinated 64 people. We've had a quiet start because we really wanted to make sure that we had everything in place the way that it needed to be and that everything ran smoothly. It was a little fun at the beginning. People were very excited to get vaccinated, so everybody came early, which was a little bit overwhelming for us. But once we got into the swing of it, it worked perfectly. I think one of the things we were most concerned about when the vaccine rolled out is that the community would be a little concerned and we would not see people joining and signing in for the vaccination program. And what we've seen over the last week is that the community has absolutely embraced the opportunity. So I think the community has realised that this is an absolutely critical thing for them to get involved in so that we're all safe and those that are most vulnerable in our community are kept safe. I think the best message is to just wait and watch, and when it's your turn, book in and come and have your vaccine, and encourage your family and friends to do exactly the same thing.
It's particularly good that vaccines are available from people's general practitioner. I think GPs are really well placed to answer people's questions and concerns and deliver it in a local and easy way for patients. People want to be doing something because we've spent a year not being able to do anything about COVID beyond social distancing and hygiene measures. So to be able to go and get the vaccine and show that you're doing something and be part of the solution to COVID, I think is really exciting for patients. My message to people who are thinking about having the vaccine is go and speak to your GP. Your GP is your trusted local resource. Find out whether you're eligible for the vaccine, and if you're keen, go and get it done as soon as you can.
Did it hurt, Your Excellency? Not at all. Very gently done.
I'm immunosuppressed, so in a high-risk group for COVID, so I'm just really grateful to get the vaccine early to remain safe and healthy.
I absolutely recommend everybody to have the COVID vaccination.
It's a privilege to be a COVID-19 vaccinator. In a pandemic, there's only so many opportunities you have in life to make a difference, and all around the country there's going to be vaccination providers doing their best, working their hardest, and we will get to everyone as soon as we are able.
It didn't hurt.
No, it doesn't hurt at all.